పద్మావతి మేడం రెడీగా ఉన్నారండి.
సునీత వస్తుందా?
మేడం వస్తుందండి.
వీడియో వస్తుందా?
వస్తుంది మేడం. మీరు కొంచెం దూరంగానే ఉంచండి, ఫేస్ చక్కగా కనిపించదు.
ఇది నాకు రొటేట్ అవ్వట్లేదు స్క్రీన్, అందుకు నీకు ఇలా.
అలాగే ఉంచేయండి మేడం, అలాగే ఉంచేయండి. కొంచెం కిందకి పెట్టండి మీ ఫేస్, మరీ అలా కాదు. ఓకే, ఇంకొంచెం కిందకి. ఓకే, బాగుంది మేడం, వ్యూ బాగుంది. వ్యూ ఓకే.
నాకు కనపడట్లేదు ఇక్కడ, కింద స్క్రీన్ ఒకటే కనపడుతుంది.
మేడం బ్యాక్ కెమెరా పెట్టేసారు.
స్పాట్లైట్ చేయలేదు, సో మీకు కనపడదు మేడం.
ఏమండి?
మీ వీడియో మీకు ప్రస్తుతం చిన్నది కింద కనబడుతుంది.
కింద అసలు కనపడలేదు సార్ నా వీడియో. కింద కూడా నాకు కనపడట్లేదు.
మేడం సునీత మేడం, మీరు వీడియో ఆఫ్ చేసి ఉన్నారు.
ఆఫ్ చేసే ఉంచాను సార్. పద్మావతి మేడం, మీరు బ్యాక్ కెమెరా ఆన్ చేశారు, ఫ్రంట్ కెమెరా
రొటేట్ చేయండి మేడం. పద్మావతి మేడం
ఏంటి
మీరు కెమెరా
ఓకే. ఓకే మేడం. మేడం స్టార్ట్ చేద్దామండి.
స్టార్ట్ చేద్దాం. ఇది కనపడుతుందా? బాగానే
కనిపిస్తున్నారు.
ఫేస్ ఒకటే కనపడుతున్నట్టుంది.
అంతే మేడం, అంతే.
అంతేనా?
మీరు దగ్గరికి రాకండి, అంతే, అలాగే ఉండండి.
నువ్వు కనపడుతున్నావు బాగా. నేను
అంటే మేడం స్పాట్లైట్ చేశాను మేడం, స్టార్ట్ చేస్తున్నారని.
పద్మావతి మేడం స్టార్ట్ చేస్తారు సార్.
స్టార్ట్ చేయమంటారా?
స్టార్ట్ మేడం.
A hearty welcome and very good morning to all the distinguished resource persons, enthusiastic organizers and esteemed participants to the international webinar on small molecule chemistry, therapeutic and optoelectronic applications. This webinar is being organized by the Department of Chemistry of SKR College for Women, Rajamahendravaram, in collaboration with SVD Government Degree College for Women, Nirthavolu. I take this opportunity to express my sincere thanks to Dr. T.K. Visweswar Rao Garu, Principal, SVD Government Degree College for Women, Nirthavolu, for collaborating with us. I heartily congratulate Dr. M. Sunita, in charge of Chemistry Department, and Sri Dr. C.H.V.V. Srinivas, Senior Faculty Member, and other faculty members of Chemistry Department of our college, and Srimati G. Tejaswini, in charge of Chemistry Department of SVD Government Degree College for Women, for the efforts in organizing this seminar. I am highly thankful to Dr. N. Sheetal Anand, Reddy Laboratories, for accepting to deliver the inaugural address. I am very grateful to the resource persons of today's webinar, Dr. S. Sudhaker Reddy from Australia, Dr. Anil Gorle from London, and Dr. S. Madhu Kiran, Pune, India, for kindly accepting to spare their valuable time and knowledge with us. On this occasion, I wish to share a few glory moments of our college. It was established in the year 1968 with a noble mission to empower women. The college was named after the wife of Kandukuri Rao Bahadur Veeresingam Pantulu, a famous social reformer of South India. The vision of the college is depicted in the emblem, Yatra Naryantu Pujante Ramante Tatar Devataha. That means, where women are worshipped, there shines the God. Our college is based on the ideology of Rao Bahadur Kandukuri Veeresingam Pantulu and is striving for the upliftment of women through women education at nominal fee. Most of the students are from rural areas and from weaker sections of the society. We have completed 52 years after 52 years, both qualitatively and quantitatively. Our college was re-accredited by NAC at B+ level and is affiliated to Adikavi Nannaya University, Rajahmundry, AP. We have intermediate traditional UG courses like BA, BSc, BCom, restructured courses in BA, BSc and BCom, and also MSc Zoology. We have fully equipped laboratories, infrastructure, digital and virtual classrooms, with and seminar halls with ICT facilities. For the all-round development of students, we have NCC and 3 units of NSS and YRC. I am very happy to inform you that NCC wing of our college has celebrated Golden Jubilee, which is the first college in the state to celebrate this Golden Jubilee of NCC. Alumni are the brand ambassadors of this great institution, who are spread all over the world and are in high positions. I am also the proud alumni of this institution. I studied here for 3 years and served this institution for 34 years as a lecturer in chemistry, and since April 2019 as principal. I also belong to chemistry faculty, and so I am extremely happy to be the part of this international webinar. I trust the participants will be enriched with knowledge as the resource persons are of high profile. I once again thank all the resource persons, principal of government SVD Government Degree College for Women, and organizers of both colleges. And last but not least, Sri Subramanian Garu for his technical support. Wishing the webinar highly successful one. Thank you one and all. Now I hand over the proceedings to Principal of SPD Government Degree College for Women, Dr. T.K. Visweswar Rao garu.
Good morning and warm welcome to the Dr. Padmavati Madam, Principal, SRK Degree College for Women, Rajahmundry, and the resource persons, Dr. Sudhaker Reddy, Saripally, Research Fellow at Monash University, Melbourne, Australia, Dr. Madhu Kiran, Sundaraneedi, Senior Research Scientist, Lupin, India, Pune, and Dr. Anil Gorle, Marie Curie Fellow, Imperial College, London, UK. The organizers of today's national webinar are small molecule chemistry, therapeutic, and optoelectronic applications, and my dear participants. At the outset, I am thankful to our Special Commissioner of College Education, Sri M.M. Naik sir, for encouraging us to conduct this type of international e-conferences. I especially thankful to the Principal Madam, Dr. Padmavati of SRK College for Women, and her continuous support in conducting this international e-conference, and I am happy to share this collaborative e-conference with SRK College for Women, Rajamahendravaram. SVD College for Women, Nidadavolu, West Godavari, is established in the year 1983. This college is affiliated to Adikavi Nannaya University, Rajamahendravaram. This college has a strength of 423 students, and the students coming from 24 villages around Nidadavolu. The main motto of our college is providing education for rural women. The students of our institution are well disciplined in all categories, and our strength is our results. For the past 10 years, the results of our students crosses the university landmark. The college has 6 different in undergraduation: BA HEP, BA English for Digital Age, BCom General, BSc MPC, BSc MP Computers, and BSc CPZ. We have 9 regular faculty members, 3 contract faculty members, and 3 guest faculty members. On invitation from GDC, Tadabelgugam, we have proctor system. Each proctor will counsel and monitor the student progression and take care about the students in all aspects. We adopted 2 villages, namely Gopavaram and Ravimetla, and our NSS volunteers work together with the village volunteers and village secretaries. Students of our college registered and completed different online courses assigned by our Commission of College Education in this pandemic situation. Now the students are engaging the classes through offline and offline as per the schedule of academic calendar and as per the CC guidelines. We started the online admissions under the guidance of APSHI and Commission of College Education from 6th of January this year. Some of the key scientific advances of the past century: nuclear energy, artificial fertilizers or vaccines came from the domain of a single discipline, physics, chemistry, or biology. As the 21st century unfolds, it is increasingly clear that the pressing problems in energy, climate, and medicine will not be solved in the same way. Instead, they will need close cooperation of the traditional branches of sciences. Such collaborative ventures will necessitate understanding of complex systems in their entirety and will build on the reductionist understanding of a system's individual components. Key insights from this system level approach will be related to the interactions between actors in a complex unity. Emergent properties observable only within a system rather than assigned to individual actors. And the phenomena that occurs across different length scales, systems, chemistry aims to retool the traditional understanding of chemical phenomena to be better situated to these global challenges. I am very thankful to Dr. D. Padmavati Madam and organizing committee, Dr. M. Sunita Madam, G. Tejaswini Madam, Dr. CHVV Srinivas Sir, Mrs. VBT Sundari Madam, Mrs. N. Swati, and Mr. P.L. Subramaniam. And I hope that today's session will be enlightened by our young resource person, and I wish this program will become a grand success. Now I wish to hand over mic to the organizers of today's e-conference. Thank you to one and all.
Good morning, all.
Good morning.
It's my immense pleasure to be a part of the national webinar, international webinar conducted jointly by SKI College for Women, Rajahmundry, and SVD Government Degree College for Women, Nedlawal. Thank you for your wonderful introduction about colleges, sir. And I am Dr. Sunita, in charge of the Department of Chemistry, SKI College for Women, Rajahmundry. It's my privilege to introduce Dr. Sheetal Anand and Manager Regulatory Affairs, Dr. Reddy's Laboratories Limited. She has attained more than 16 years of progressive experience in global regulatory affairs in various capacities as chemist training, senior executive, senior analyst, team leader, expert, and single point of contact for North Asian region in Dr. Reddy's Laboratories Limited. Ample of regulatory experience gained in drug master file submissions, life cycle management, handling changes across the key regulatory markets and emerging markets, support to ANDA, ANDS, NAA approvals. She visited US, Switzerland, and Denmark on business. She was awarded PhD from Jawaharlal Nehru Technology University, Hyderabad, India in 2016. She hails from Kakinada city, Andhra Pradesh, India. Her husband is P. Dinesh and blessed with 2 children, Aradhana Dinesh and Kirtana Dinesh. She is confident, learner, self-starter, and a team player. She is equipped with excellent oral and technical writing and training skills. Very good at interpersonal, technical writing, communication, presentation, and negotiation skills. I'm so happy to give these introductory lines about my friend, Dr. Sheetal Anand, and now invite her to give inaugural address. Welcome, Sheetal.
Thank you, Sunita. Thank you very much for that introduction. So I'm very delighted to be part of today's program organized by your colleges. So first of all, good morning to all the principals and lecturers, students, and today's speakers. So it is my privilege to give this introductory note on your webinar, Small Molecule Chemistry, Therapeutic and Optoelectronic Applications. So I'm so thankful to the colleges, SKR College for Women, Rajahmundry, and SVD Government Degree College for Women, Nerdovolu. And I'm very glad that this forum consists of all girls students. So I really love to encourage girl students, as we see many of them in the field of technology. And I'm sure there are many aspiring students in these colleges are pursuing various courses, and I'm sure they'll come out with flying colors. So I would just like to give a very short introductory note, not taking your time. So as today's webinar is about small molecule chemistry, therapeutic and optoelectronic applications. So I just want to brief you about what is nanotechnology and how does it improve and what is its utility. So it presently it is improving the existing industrial processes, materials, and various applications by scaling them down to the nanoscale. And you know how small is a nanoscale. So in order to ultimately fulfill and exploit the unique quantum and surface phenomenon that matter exhibits at nanoscale. So the nanotechnology mostly lowers cost, produces stronger and lighter wind turbines. It improves fuel efficiency, and thanks to the thermal insulation and some nano components that can save energy. So the properties of some nanomaterials make them ideal for improving early diagnosis and treatment of neurodegenerative diseases or cancer. So, as you all know, nanotechnology, it mainly makes use of the very small molecules, as it is said in the today's title. So I would like to mention that there are few advantages of nanotechnology today. So it is also being used in various fields. So to begin with, because I'm from the pharmaceutical background, nanotechnology is being employed in the pharmaceutical field for many reasons. So perhaps the leading goals from the pharmaceutical industry are to improve the drug solubility. So the drug intake, when the patient takes the drug, it is very important the drug gets soluble. So it helps in drug solubility and bioavailability. We call it bioavailability. It means the availability of the drug at the target area in the body, and for delivery to various sites of action inside the body. So nanotechnology is also being employed to develop new and improved therapeutic devices. So there are different therapeutic devices. So even in this area, nanotechnology is being used. And I have also come across nanotechnology being used in solar cells via nanotubes, quantum dots, and hot carriers could reduce the cost of PV cells and um, modules for bulk power generation, as well as improve the cell conversion efficiency. So I have also just jotted down some more points where and it helps in the improved understanding of chemicals at the cellular and molecular level, and improved identification and validation of target proteins and drug levels, and the reduced time for the identification of new drugs. So there is a lot of research going on for new drugs. So it also reduces time for the identification of new drugs. As we know, for a drug to come into the market, it takes more than 20 years. So reduction of precious reagents to screen potential drugs, improved visualization of drug interactions, increased throughput. So in the industry, nanotechnology is very, very important. So therefore, if you see, you find applications of nanotechnology in various fields, say energy, cosmetics, nanobiotechnology, optical engineering, defense and security, bioengineering, medicines and drugs, nanofabrics, and you see it in household also, and information technology also. So having said that, I would like to leave the program for the eminent speakers who are going to take you through various topics, and I'm sure this is going to be a very good treasure for all of you to take away home some knowledge from today's webinar. So I would like to hand over the program to the next speaker, SKR College for Women, Rajahmundry. Thank you very much for having me here.
Thank you, Shikal. It is wonderful addressing the program. Let's hand over the program to Dr. CHV Srinivas.
Good morning, all of you. I am Dr. CHV Srinivas, lecturer in chemistry, SKR College for Women, Rajahmundry. I feel it a privilege to introduce the speaker for the international webinar, Dr. Sudhaker Reddy, Saripally. Dr. Sudhaker Reddy completed his post-graduation from Vellore Institute of Technology with organic chemistry as the major subject, and received his PhD in chemical materials from Hosan National University, South Korea. During his research, he developed rational design and synthesized new organic small molecules for optoelectronic applications, such as OLEDs, organic solar cells. Later on, he worked as a postdoctoral research fellow at Hosan National University, South Korea, and developed new polymers. Dr. Reddy has vast experience in the area of synthetic organic chemistry, material chemistry, and polymer chemistry. To his credit, Dr. Reddy published research papers in 22 internationally reputed journals with high impact factor. Dr. Reddy is also a peer reviewer for internationally reputed journals from Ville, ACS, and RSC. Apart from research experience, Dr. Reddy gained industrial experience also. Currently, Dr. Reddy is a research fellow at Australian Centre for Advanced Photovoltaics at Monash University, Melbourne, Australia. His research interest includes the design, synthesis, and characterization of new organic functional materials and π-conjugated polymers. Now, I request Dr. Sudhaker Reddy to continue the lecture. Thank you. Dr. Sudhaker Reddy.
Yes. Yes, can you see my slides?
Yeah.
Okay,
Yes, sir.
first of all, thank you very much for the warm introduction. And thank you very much for everybody. And I'm very happy to present on this platform today. I think all are like masters and bachelors guys, and also some research fellows might be there. So my research will be useful for all physicists and also chemists. So definitely they may get some new points if somebody wanted to do PhD or whatever, like, somebody wanted to go to research like industry, definitely this will be helps out. Okay, today I'm going to talk about a small molecular chemistry for optoelectronic applications. So let me put very clearly, there are two kind of like chemistry. If you are a chemist, by using our molecules, there are it's like two kind of applications. So one is like a biological, another one is optoelectronic applications. Whereas in biological, you can see into like medical applications, all the stuff. Whereas in optoelectronic applications, like OLEDs and also solar cells, perovskite solar cells, those kind of things. Now I'm into optoelectronic applications where I have been worked on like OLEDs, organic solar cells, and perovskite solar cells as well. So I would like to give brief introduction about OLEDs and organic solar cells. So let's see OLEDs. Suppose like probably everybody aware of OLEDs nowadays. Each and everybody using smartphones like Samsung phone, iPhone 12. You can see that OLED display. Like OLED displays are there in Samsung Galaxy S21, I guess, and even iPhone 12. And now I'm gonna explain like what is the significance of all those stuff. Say this is like a Jablonski diagram where you can see this. This is a Jablonski diagram. I'm gonna explain like what is exactly fluorescence, TADF, and phosphorescence. Whereas in fluorescence, when any molecule absorbs a light, it will go to excited state and then it will come back to the ground state. That time we'll get some kind of colors. So how it's coming, whether it's coming from singlet state, whether it is coming from triplet state, then we can see here. Whereas in S1 to S0, this is called a fluorescence. Whereas in T1 to S0 phenomenon is called as a phosphorescence. And TADF, thermally activated delayed fluorescence. This is like a third generation technology, which is one of the emerging technology here. So what happens in this? So if you want to make a TADF material, the delta EST, which means that the singlet and triplet energy difference, the difference should be very small. That means less than 0.1 electron volt. Then we can make a molecule. What happens in this case, the triplet excitons will go back to the S1 state by reverse intersystem crossing phenomena, and then it will come back to ground state. This is a TADF. Now we know what is a fluorescence, what is TADF, and what is a phosphorescence. So generally, OLED device structure should be like this. This is a typical device structure which consists of active layer. That's it's called as emissive layer. So electron transporting layers as well as a hole transporting layer. So this is a like energy level diagram. We are injecting both holes and electrons into anodes and cathode respectively. Whereas in holes injected through anode, this side, like I2A is a kind of anode, whereas electrons are injecting from aluminum here, and then electrons and holes are recombining here, and it forming kind of excitation. So here there is a like color emission. So this color emission is depends upon the material, that what kind of material we are using in the device. So this also we can see that how excitons, like singlet excitons, there are 25%. Of course, everybody might aware of these, all those things. Whereas in triplet excitons, it's 75%. As I already explained, like what is the TADF and the fluorescence materials. So coming to other part, now we understand what is the basic fluorescence, TADF, phosphorescence, how OLED device structure will be, and also how energy level diagrams. As a chemist, what can we do? As a chemist, we can synthesize organic emitting materials and also hole transporting materials, electron transporting materials. How to design these materials? So what color, like if you're expecting for blue color, so what are the key points that we need to keep in mind? So and also another important factor is external quantum efficiency is calculated by using these phenomena. Outcoupling efficiency, it's a multiplication of all these three. And as a chemist, we need to focus on quantum efficiency yield. This is called photoluminescence quantum yield. So this can be increased by chemist by designing a new kind of materials with proper conjugations and breaking a linkage of all those. That I'm going to explain in the further slides. So here we can see that what is that quantum efficiency. And as I mentioned, we can increase that quantum efficiency by designing new materials. So these advantages of OLEDs, as I mentioned, that we can see in the Samsung Galaxy phone, iPhone 12, and also so many OLEDs are there. There are so many companies in the race to manufacturing all those things. Even LG company, Boy Display, and also Samsung. When I was in Korea, I have been working with Samsung. So we collaborated very closely, and we synthesized different kind of materials, and they have been, we did R&D, and then they tried to enhance the stability and also efficiency in Samsung company. So the main challenges in OLEDs are like deep blue emissions. There are three colors especially, as we all know about it, like blue, green, and red. So green and red colors have been commercialized. So I'm not gonna talk about all those things, and I would like to focus on deep blue emission. During my PhD postdoc, PhD, I've been focused on this blue emission. So deep blue emission is a very important thing, and also this is important because this can be used in even white lights. So that is one of the reasons people are focusing on deep blue emission. So design deep blue with NTSC standards like National Television Standard Committee and also EBU, European Broadcasting Union. These are a standard. Based on that only we can say this is a blue color, this is a green color, this is a red color, something like that. And also high external quantum efficiency is very difficult that we need to be sorted out. And also stability is one of the most pressing concern in OLEDs. And high triple energy host materials. As I mentioned in the device probably, so we have seen that emissive layer, we can use only fluorescent emitter and also host gas system we can use. So those materials energy transfer from host material to the dopant, and that excitant formation will be broadened. Thereby the efficiency will be enhanced. This is a general CIE diagram. From this we can say this is NTSC standard color, Y coordinates is which very important, 0.08. Whereas in this x-axis 0.06, these are the standards. So suppose if you want to design a fluorescent emitter, you need to increase the fluorescent quantum yield. Whereas in bipolar host material, you need to choose a material which is having a high triplet energy. So whereas in TIDF emitters, as I mentioned, the delta EST, the energy difference between singlet and triplet must be very small, which is a less than 0.1 electron volt. In addition to that, these materials should have proper energy levels so that holes and electrons will be injected properly. And also it should have very thermal and morphological stability because these stabilities are very important to sustain it for longer operational stability. And also high mobility. As I mentioned, we are injecting holes and electrons from anode and cathode. So it should have a very high mobility. Then only it can go very fast to the active layer. Their excitant formation will be very broadened. And also it should have very good solubility because we are using it by solution process. If the metal is having very good solubility, then spin coating, morphology, all those will be very good. Eventually the efficiency will be increased, which will also affect in stability too. So what I did during my PhDs and when I was a researcher, I designed this is kind of acrylic material and this kind of donor materials, which is all electron donating properties. And whereas acceptor cases, this all electron withdrawing nature, a different kind of derivatives of imidazole, oxadiazole, and phenanthralene, so sulfone, all those things. So I linked these materials into different linkages so that we can see that whether the material is used for fluorescent emitter or bipolar host or TIDF emitter. See, this is the synthetic route for the materials that have been synthesized. It's a simple synthetic route. We can see this is esterification. All the steps we got very, very good yields. Whereas in this again, by using Grignard reagent, we form alcohol and then cyclization with phosphoric acid. And then again, it's simple Buchwald reaction. We got pretty much yield here, and this borylation, and finally coupling reactions. This all everybody knows about Suzuki coupling reaction. So I synthesized two different kind of molecules with the para linkage and meta linkage, or we can say that fourth link as well as a third position link. So there is a small linkage, only third and fourth position. When you can see the properties and efficiency, there is a massive difference between them. So here these properties are very important in order to say whether the material is a blue color or some other color. And also see photophysical properties. I had checked in different solvents and film as well. Like we got it like 431 nanometer and 436 in solution. So whereas the P link is para, I can hereafter I will donate as a para and meta. Like we got 436 nanometer, which is in blue color. Even 431 is also, it's a deep blue emission. So here in film also I check like it's 417 and 431, 438 nanometer, which is like a blue emission. And in addition to that, thermal properties are very important. If you, one of fabricator, if you wanted to say that if the material is thermally stable, we need to investigate by using a thermogravimetric analysis, TGA, and differential scanning kilometer, DSC. So this is from TGA curve, like we can say thermal decomposition, TD I mentioned here. These both the materials are showing thermally stable over 440 degrees centigrade. Whereas in DSC, this spectra will give like a glass transition temperature. Both the materials fortunately have very good glass transition temperatures, which will also helps in morphology. So coming to the electrochemical properties, this is a cyclic voltammetry. So from this, we can estimate HOMO and LUMO energies. So HOMO is calculated from this onset oxidation value. Like probably you guys might aware of Nanotechnology equation. If you put all the values over there, you'll get the like HOMO energy levels here. And here we got like when you do this one, we got minus 5.34 electron volt in both the cases. Why both the metals having the same? So in order to examine that one, why this HOMO is same for both the materials, then we do the like kind of theoretical simulation by using a DFT, density function theory. You can see here in HOMO, the HOMO electron density is located only on acridine, but not on other things. So even in this AFM meta case also, that HOMO electron density is located over on acridine. That was the reason we got similar HOMO for both the materials. But whereas in LUMO cases, it's distributed over like a fluorine the stuff. That was the reason there is a small deviation in LUMO energies. And another thing is like charge transporting properties, like mobility or electron mobility, hole mobility. So if you wanted to say this material is a hole transporting nature or electronic transporting nature, we need to investigate by using like a SCLC method, different kinds of method is there to find out that charge transporting mobility. Our materials are both like hole transporting materials as well as electron transporting materials. Like that is the reason we call them as a bipolar, because it has like a donor as well as acceptor. Because of that reason, we are calling them as a bipolar charge transporting properties. This is like a device fabrication. As of now, we discussed about the material synthesis and kind of photophysical properties, thermal properties, electrochemical properties, and charge transporting properties. The another final one is like a device fabrication. So if you fabricate by using these materials as an emissive layer, then we'll come to know what is the like emission of like what is the external contamination of the material and what color does it exhibits. So in this case, fortunately, we got it over 5% for AFP PPI case. Whereas in this case, we got less, but its CIE coordinates is pretty good, as exactly matches to EBU standard, as I mentioned earlier. So in this case, what happened is supposed to be 0.08 is like, which is exactly matches to NTSC, but is a little higher. So what I thought, I need to design a material which exactly matches to EBU standard or NTSC standard. So later on, like I modified the molecular structure by breaking the conjugation over here. So what happened, like if you see the previous structures of phenanthrolene, like you can see the previous actually phenanthrolene structures, whereas here the conjugation was broken. It's like a triphenyl imidazole now. Similarly, para and meta. Here also both the materials are showing like a deep blue emission. And also like here also HOMO energies for these two materials are same. And when we fabricated into device, we got like approximately 5%. But the most important thing is like the color of these materials are like exactly matches to EBU, like which is like 0.06. So further, I have like, synthesized different kinds of material with different linkages by using a phenylacridine materials and triphenyl imidazole and also phenanthrolene, different kinds of materials. These materials, I investigated all the properties in order to see these materials can be used as a fluorescent emitter or like a host materials. So by using these properties, we found that this one material is a very good as active material, like a fluorescent emitter. That means like non-doped. We are not doping anything into the material. So whereas in this fourth material, it has like a very good triplet energy material. Because of that reason, we use that material as a host, and another iridium complex we use it as a like a dopant. Then we got very good external quantum efficiency. So another material in OLEDs, designing a single material with high thermal stability, very good solubility, deep blue emission, and having FWH very small, half like full width at half maximum, which is like a narrow spectra, which is quite difficult to accomplish such kind of spectra. So I designed with started with the triphenylamine as a core and extended the conjugation with the fluorine, and terminated the molecule with the acridine material. So this inside with the simple coupling reactions, and I investigated all the properties. Like this material shown like very good deep blue emission with the 431 nanometers, even in solution and film as well, which shows that there is no intermolecular interactions between the molecules. So it's very good even when we fabricated in devices too. And this material is thermally stable, and even glass strain temperature is very high. And this material is a suitable homoenergies to fabricate to OLEDs. So here we got like over 4% OLED external quantum efficiency, and we use different kind of solvents like halogenated and non-halogenated. We all know that halogenated is good to use in the fabrication, so we use a non-halogenated solvent here. Fortunately, in non-doped and doped cases, we got like a pretty much good efficiencies here. And another thing is TADF, as I mentioned, thermally activated detailed fluorescence. And we synthesized two different kinds of materials with different linkages, 3 and 4. And this have been collaborated with Professor Adachi in Japan. So we also checked different kind of solidochromism by using from non-polar to polar solvents. It shows like a bathochromic shift. It's like largely shifted from non-polar to polar solvents. And these two materials are TADF, and one of them I show like a pretty much good efficiency when compared to that of 4A. Now, as of now, this business was about like OLEDs. Now, like probably how to design OLED materials, how to accomplish high efficiency, stability, those things we discussed. So now coming to solar cells. Solar cells, when any solar cell absorbs light, it will absorb light. It will get excites, and there is kind of phenomena takes place here, holes and electrons kind of excitant generation, and it will diffuse at the interface, again excitant dissociation. Finally, the charge transports charge transports respect to electrodes, like holes will transfer respect to anode side, and whereas in electrons will transport toward the anode side. This is the phenomena. So we have in India, we have like a lot of sun, we need to utilize that sun by using, of course, here in India also there are so many solar panels. Currently, the silicon-based solar cells are commercially available, and in fact, they are expensive in terms of rate. So I've been focused on like organic solar cells and perovskite solar cells. As a chemist, we design different kind of photoactive donor materials and interfacial materials, as mentioned, like a charge transporting or hole transporting materials. Here also, if you want to say that material is highly efficient by using PCE, this is the formula that we have to calculate, which comprises of all JSC, VOC, fill factor, all those things. So as a chemist, like if you design a very good hole transporting material or a photoactive donor materials, really we can accomplish higher efficiency and very good stability too. So as of now, commercially available solar cells, perovskite solar cells, we can see that certified efficiency of 25.2%. This has been published in Korea, like organic solar cells is 16.5%, and tandem solar cells is 14.2%. There has been a lot of research going on perovskite solar cells. It has been started in 2009 at 3.8%. Then there was a dramatic improvement from 2009 to 2019. It accomplished over 25%. And there are a lot of things need to be sorted out in terms of interfacial materials and efficiency too. Is a periodic table, like whenever we look into, if you want to design new kind of perovskite materials, all those things, we initially choose like materials. So perovskite materials are the recently emerging technology, which is comprises of like both ABX3 kind of things, and it's kind of organic and inorganic, both mixed halide cases. So when you see organic based, people are using like methyl ammonium, cyclohexyl, phenyl, those things. Whereas like inorganic cations, like lead is properly, as of now, the best efficiency showing lead. And you can see that groups like, third and fourth year groups are very important to design new kinds of perovskite materials. So this is a perovskite structure. It's kind of ABX3, and this again, like, whereas A and B are the cations, and whereas X is a halide. And this perovskite is classified into two types. One is a mesoscopic, and another one is a planar perovskite solar cells. This planar again classified into two types based on the alignment and NIP and PIN. This depends upon that how your interfacial materials electrodes are using. So this HTM, like whole transporting materials, again, like it's classified generally into two types, organic and inorganic. And these are organic again classified into three types. One is small molecular and oligomeric and polymeric. So I choose a small molecular HTM because it has intrinsic properties such as fine tunability of the molecular structure and high reproducibility and high purity too. And in order to design an ideal HTM, it should have that compatible home energies and also like good solubility and high hole mobility and thermal stability as well. So this is like a Spiro OM. This metal is commercially available, but when this material is having a low mobility in its pristine form. So what happens, like people are using like additives and dopant such as a TBP and lithium TFSI. By using this material, though we are accomplishing higher efficiency, but there is some issue with the stability. So in order to increase the stability as well as stability, we design different kinds of materials and see how we design the materials. This is a material that have been designed, and this is like a simple coupling reactions by Ullmann coupling, and kind of like simple Buchwald reactions and borylation and Suzuki coupling reaction. So I have synthesized two kinds of like derivatives here. One is with just H, and one more is a cyano compound. And this material, as I mentioned, like I have investigated all the properties, photophysical, electrochemical, thermal properties, and also Davis fabrication. Interestingly, this material showed very good properties, very thermal stability, and very suitable homo energies, which is suitable for the adjacent perovskite material. So it has high thermal stability and high glass temperature too, and it has a very good mobility. Therefore, we use it as a whole transporting material in the perovskite solar cells. And when fabricated in the device, we got efficiency of 17% in 2016. This has been published in Advanced Material. And we also like use this material as interfacial material in organic solar cells too. And here also we got very good efficiency and stability. When we got like a better stability, we also investigated what would be the reason for enhanced stability. Then we investigated further like water contact angle. So from that, we got that because of this hydrophobic nature of the material, we accomplished better stability. So another material we designed by terminating with the triphenylamine structures. And this material also having very good mobility, and also this is like a new technique, a TRMC, transient microconductivity, that has been used in order to investigate the conductivity and the whole mobility of this material. This has been collaborated with Japan, and this is one of the best technique in order to say whether that how much it can extract the holes and it can transport the respective electrode. So this material used as HTM in both rigid and flexible cases, and both the cases will show like a very good efficiency when compared to that of standard materials. And you can see these flexible devices and rigid structures, and we got pretty much good efficiencies. And we also investigated what is the reasons behind this stability and these water contact angles. And finally, we concluded that our material is hydrophobic in nature. And different kind of materials also synthesized like this, triphenylamine and biphenyl as a spacer, and luxurizer like donor, spacer, and etc. things. This material also showed like very good home energies as well as mobility. Therefore, we use this material as a whole transporting material in both like, both flexible as well as rigid. In rigid case, we got over 15%, and flexible like approximately 13%. So as I mentioned, triphenyl, this pyridine is using as a dopant. So what I thought like we'll incorporate this pyridine into the whole transporting material, and we'll see how properties will be. So interestingly, this we got like very interesting properties of like very good suitable energies and high glass temperatures. And also, so we also use like a organic dopant. So we saw like how interactions happen in this. We got very good efficiency, and we investigated what would be the basic chemistry behind that to enhance the PC as well as the stability. When used a BCF, this organic dopant, then we understand that this is the reason because of LABA, Lewis acid base electroformation between this Lewis acid and pyridine. This was the reason to get high morphology and stability as well. And some different class of materials I have synthesized, like here amphiphilic type and also this closer thing. Surprisingly, when I was synthesizing these materials, this was my target, but this is a precursor of this step and then cyclization. So what we thought, we have hydrophilic groups inside and this hydrophobic, and well, okay, let's use this metal as a HTM in perovskite solar cells and let's see how efficiency works. Then fortunately, this material showed pretty much good efficiency and not much efficiency, but stability is very good. When you see this hysteresis effect, there should not be such kind of hysteresis in usually perovskite solar cells. But whereas in Spiro, when you use like Spiro without any dopants, like there is a large hysteresis, whereas in this HTM1, we use it as a no hysteresis at all. Then we thought this is a very good in nature because of this amphiphilic nature, like internal hydrophilic groups like OH, hydroxy groups, whereas in terminal like hydrophobic these groups. Because of this reason, we got very good stability too. So further, the side chain liquid crystal polymer also, like we doped into the perovskite material and we accomplished, like we investigated all the properties, like we got more than 20% efficiency in this. And in addition to that, in addition to small molecules, I extended my research to polymers too by using a BDT structure and BDD, such kind of a naphthyl groups and side chains. And since a different kind of molecular weights, like a different, like one polymer with different molecular weights. Interestingly, these properties, like very interesting properties, and utilized as a photoactive donor materials in organic solar cells. And we also use different kind of solvent like halogenated and non-halogenated. In both the cases, like we got pretty much good efficiency, and we use a non-halogenated solvent as a toluene and diphenyl ether. So most of the people are using chlorobenzene, which is not good for the commercialization. And coming to this, like very recently, this one like synthesized, and by using siloxane, there are very interesting properties here. And we can see that absorption spectra and even the device performance is very good in this. And this has been published in Solar RL very recently. And you can see that stability is very good, and V is completely green solvent. We can say it as a green solvent because since we did not use any halogenated solvents, we used it as both binary and ternary cells. We got efficiency of 13% in this case. So this all like about OLEDs and solar cells, and solar cells, different kind of like organic solar cells and perovskite solar cells have been synthesized on small molecules and polymers, and OLEDs, different kind of host materials and fluorescent emitters. We accomplished blue color too, and whereas in solar cells, like we accomplished some certain efficiency like over 17%. By doping, we got over 20%. Still, there are some issues need to be concerned in terms of perovskite solar cells, such as like higher stability and reproducibility. Those are the main things. If you could able to achieve those things, definitely perovskite cell will be commercialized very soon. These are few selected papers during my PhD and postdoc. And thank you very much for your attention. And yep. In addition, like if you have any questions on this, it's fine. If you have any questions related to any other thing, also fine, because there are so many masters and a PhD. When TV Rao mentioned that there are so many people from rural area, I felt very happy to see everybody over there. I know that they might be facing some problems to go for higher education or industry, because 2 years ago, I also gave a lecture in Padmavati Mahila University. Those days, I understand that how the people are struggling and thinking and what to choose, where to go after masters, like a lot of questions arised. So I clarified, and I think this is a time to know, this is a time to ask any kind of questions. And first, like now it's time to thank you very much for everybody. Thanks a lot.
Thank you.
Yep.
Thank you, Dr. Sudhaker Reddy. I believe that your lecture will definitely useful to the upcoming organic Thank you, Dr. Sudhaker Reddy.
Yep.
I believe that your lecture will definitely useful to the upcoming organic and polymer research scholars. It is very interesting to hear about the photophysical, thermal properties, fluorescent materials, fluorescent emitters, solar cells, OLEDs. The lecture will definitely enlighten the knowledge of all the participants. Thank you.
Thank you very much, Professor. Yeah, thanks a lot.
Thank you. Thank you.
And I think I'm expecting few questions from the students. I think if you have any kind of questions, I would really happy to tell you, like in terms of everything, in terms of research. Like, yeah, I think it's pretty clear from this platform, everybody will get a lot of information. As Seetal mentioned, like, I think significance of nanomaterials and solar cells, other stuff, and also other persons will be giving on, and also therapeutic, like medicinal electronic properties, like electronic properties. We have everything here in this platform, like, those are working on electronics, those are working on medicinal. So everybody is here. I think this is the right time to ask any kind of questions. So anyway, choose the one like which you like, where you want to land, like whether you want to go for industry or academic or whatever research, and choose the topic now. Students, like,
Thank you. It seems there is no questions.
Thanks a lot.
I think
thank
so.
you very much. Yeah, thank you very much.
Thank you. Thank you for your enlightening lecture. Thank you. The next lecture will be followed by Dr. Anil Gorilla and Srimati VBT Sundari, lecturer in chemistry of SKR College for Women, Rajahmundry, will introduce Dr. Anil Gorilla.
Good morning to all. Good morning to all. Myself, VBT Sundari, lecturer in chemistry, SKR College for Women, Rajahmundry. It is a great pleasure to introduce our resource person, Dr. Anil Gorle. Dr. Anil Gorle obtained his chemistry PhD degree in 2015 from University of New South Wales, Australia. His PhD studies identified mono and multinuclear ruthenium-2 complexes that were highly active against a range of clinically significant pathogenic bacterial strains. Prior to undertaking his PhD in Australia, Dr. Gorle had gained 4 years of industrial experience as a research scientist at Albany Molecular Research Organization in India, where he developed skills in multi-step organic synthesis and in a range of analytical and spectroscopic techniques. Since joining Griffith University in 2016 as a research fellow, Dr. Gorle has built on his significant contributions in the field of medicinal inorganic chemistry and has played a central role in the development of metalloglycomics as a new research field of endeavor. He has presented his research findings as a selected talks at the International Bioinorganic Chemistry conferences. As a recognition to his scientific achievements, Dr. Gorle has recently received the prestigious Marie Curie Fellowship Award from European Commission to undertake an antimicrobial research project at the Imperial College London, UK. Today, Dr. Gorle will present his exciting research outcomes that he achieved during his postdoctoral appointment at Griffith University, Australia. Thank you. Now, I am inviting Dr. Gorle garu to give a lecture. Welcome, sir.
Sir, please unmute, sir.
Okay. Can you hear me now?
Yes, sir. Yes, sir. It is audible, sir.
Okay. Just give me 1 second. I'm trying to share my presentation.
మా రెండమ్మ బాబు మాకేం తెలియదు ఇక్కడ వెళ్తారు.
I'd like to thank the organizers for this opportunity to present my research with you all, and thank you for the kind introduction. I hope you all can hear me clearly and see my presentation.
Yes, sir.
If there is any problem, please let me know.
Okay, sir. Sure.
Yeah, so today I'll be presenting some of my recent research findings that I achieved as a research fellow at the Institute for Glycomics, Griffith University in Australia. As you can see, the title of my today's talk is Metalloglycomics, a new research field of endeavor. In today's talk, I'll be giving you a brief introduction on why we think metalloglycomics can be a new research field of endeavor, and I'll also give you introduction on metal-based drugs that are currently in the clinic for treatment of wide range of cancers, and then I'll give you how protection of sugar molecules on cell surface can actually provide opportunities for the development of novel cancer drugs.
One second, Dr. Nari, 1 second. Sorry for the disturbance. I think it would be great if you could maximize the screen. I think it's not maximized. I think just can you please click the down button?
Please close the note, sir.
Yeah, note. Yeah, it would be great if you could close the note as well as.
Okay, just 1 second.
Yeah, complete down right side. There is like one. Click it and you can maximize it.
I cannot see it here. Oh,
probably right bottom side there might be one kind of icon like max. Yep, now we can open it.
Okay, so can you see
Probably
it now?
you can drag that line which is separating the next slide in the main presentation. Yes.
Is that all right now?
Yeah.
Okay. Can you see it clearly, the slide? Okay. Thanks for that. So as you can see in this slide, there are some metal-based platinum drugs that are currently in the clinic for the treatment of a wide range of cancers. So as you can see here, cisplatin, which is a mononuclear platinum-based drug, this drug was invented first in 1960s, and then it was approved for clinical use in 1978. So why these drugs are called platinum metal-based drugs is because there is a metal in the center of these molecules. It's denoted as PT here. PT means platinum, and it is a metal. So since there is a metal involved in this compound, it's called a metal-based drug. So after the invention of this metal drug cisplatin in 1970s, so research was focused heavily on the development of platinum-based drugs. And after 6 to 8 years, there was another drug that was invented and was approved for clinical use, and it was carboplatin. And in 1990s, another platinum drug was approved, and it was oxaliplatin. So these drugs have been in the clinical use from last 30 to 40 years. And still, even today, these drugs are given to cancer patients at different stages of chemotherapy. So the main biological target of these drugs is the intracellular DNA. So these drugs target the intracellular DNA of the cancer cell and stop the cancer cell replication, and that is how these drugs kill the cancer cells. So although these drugs have been widely used in the clinic for cancer treatment, there are some side effects in using these drugs. So mainly the side effects are these drugs exhibit toxic side effects. For example, neurotoxicity, nephrotoxicity, and etc. And these drugs, while they are highly active at the beginning of the chemotherapy sessions, for example, if a patient is prescribed for 6 to 8 chemotherapy sessions, at the beginning, like for 2 to 3 sessions, these drugs are highly active in reducing the tumor growth. But when the patient goes through 6 or 7 or 8 session, these drugs does not show effective growth reduction in those later stages of the chemotherapy. So that was one disadvantage in using these drugs. So that is called acquired resistance. That means cancer cells develop resistance over the period of time. And another disadvantage in using these drugs is its dose limitation. This drug cannot be used at higher doses. While there are some disadvantages, there are advantages also in using these drugs. The main advantage is that this drug can be used for a wide range of cancers, for example, ovarian, lung, and etc. And another thing is that these drugs can be used alone or in combination with other chemotherapy drugs. For example, there are other drugs that are in the clinic for cancer treatment that does not contain metal. Those are called organic drugs. So these platinum drugs can be used along with those drugs. That's called combination therapy. So this is a very big advantage of these platinum drugs. And as I said, these drugs bind to DNA and stop the cancer cell replication. It's a programmed cell death called apoptosis. So based on these advantages, it was very clear in 1970s through 1990s that platinum drugs can in fact actually be very useful for cancer treatment if further research is done on these platinum compounds. So because of those side effects that those mononuclear platinum compounds exhibit, research was focused heavily on developing the platinum compounds that exhibit higher activities against a wide range of cancers, but also exhibit very lower side effects compared to the already approved clinical drugs such as cisplatin, oxaliplatin, and carboplatin. So in late 1990s, Professor Nicholas Farrell, who is our collaborator and my current supervisor, he was the first one to break that cisplatin rule. So when I say cisplatin rule, it is because it is that if you see these 3 molecules, cisplatin, carboplatin, and oxaliplatin, all these 3 molecules have a similar template. So they all have cis orientation. Although the groups, the substitution groups on these 3 molecules are different, they do have a same template. So these drugs follow cisplatin rule. So all these drugs were highly active, but they do possess side effects. So Professor Farrell thought that, okay, so the platinum drugs, they exhibit high activities against cancers. So what if we break the cisplatin rule and design something completely different, then that type of compounds can exhibit higher activities and lower side effects. So that was the reason why he came up with multinuclear platinum complexes. So what is a multinuclear compound? Multinuclear platinum compound. Multinuclear platinum compounds are compounds that have more than one platinum metal in the compound. So for example, in this compound, which is BBr3464, there are 3 platinum metal centers in this compound. So that is why this platinum compound is called multinuclear platinum compound. So this compound was studied heavily, both in vitro and in vivo against various cancers. And it was found out that these types of compounds are highly active against cancers, and they are highly active even against cisplatin resistant cancer cells. That means the cancer cells against which cisplatin like molecules does not show activity, even for those cancer cells also, against those cancer cells also, these compounds showed higher activity. So why these compounds showed higher activity against a wide range of cancers? So that was the question. So the main reason these compounds are highly active is because these compounds react with DNA in a fundamentally different manner compared to cisplatin like drugs. I mean, you would expect a different sort of DNA binding for these compounds, because these compounds are completely different compared to cisplatin. And that was the reason why these compounds are highly active and less, and they even against the cisplatin resistant cancer cell lines. So I'll briefly talk about their DNA binding abilities. So here I showed on the right side, this is a DNA template. So what cisplatin does once it is inside the cancer cell is that it binds to one of the 2 strands of the DNA. It rarely binds with both the strands of the DNA. So when it binds with both the strands of the DNA, that type of binding is called interstrand cross-linking binding. If it binds with only one strand of the DNA, that means with just one piece of the DNA, then it's called intrastrand cross-link. So these cisplatin-like molecules, because of their because those molecules are very small and they are mononuclear compounds, they only bind with one of the 2 strands of DNA. They do not bind with both the strands. So majoritarily that is what happens, but we do see a minor interstrand cross-linking. So whereas if you see the multinuclear platinum compounds, as you can see on the left side here, they only form interstrand crosslinks. So that means they do bind with both the strands of the DNA. So that is a fundamentally different way of binding. So this type of binding was responsible for its higher activity even against the cancer cells on which cisplatin and other molecules are less effective. So here, so BBR3464 was highly active against a wide range of cancers, even in vivo and in vitro. So based on those activities, Professor Farrell and his team, they performed extensive biological studies on these compounds. And based on those biological studies, this BBR3464 compound actually cleared the phase 1 clinical trials, and then it went on to phase 2 clinical trials. So in phase 2 clinical trials, it was identified that when this drug is injected into the bloodstream of humans, what happens is that this chloridoligand, which is attached to the platinum center, gets displaced by thiol-containing proteins that are circulated in our bloodstream all the time. So that means this compound, when it's injected into the bloodstream, it forms unwanted products. These products are unwanted products, they do possess some toxicity. So that means when this drug is administered into the bloodstream, there will be some unwanted products, and due to those products, this compound exhibit some toxicity. Because of that toxicity, this compound was rejected from phase 2 clinical trials. So then the idea was, what if this chloridoligand can be replaced with a compound that with a group that cannot be displaced by the thiol-containing proteins in the bloodstream? So that was the idea. Based on that idea, Professor Farrell and his team developed non-covalent polynuclear platinum compounds. So they replaced the chlorido. So I denoted here X. X means X can be amine and or the amine containing aliphatic linker. So they replaced this chloridoligand with these groups. so that these compounds can no longer participate in covalent bond forming reactions with thiol containing proteins in the bloodstream when they are injected into the bloodstream. So now they tested these non-covalent polynuclear platinum compounds. So why these are called non-covalent is just because they cannot form the covalent bond with a protein or other biological molecules that are present in the bloodstream. So since they cannot form that covalent products, these are called non-covalent products, and they do interact with those biomolecules through non-covalent electrostatic interactions. So the next question, these non-covalent polynuclear platinum compounds, they are highly active. So the next question is, do they get into the cancer cells? Because these compounds needs to get into the cancer cells. That is when they can exhibit their activity by targeting the DNA, and as a consequence can kill the cancer cell through a programmed cell death called apoptosis. So what is the mechanism for these non-covalent platinum drugs to enter into the cancer cell? So to identify the mechanism through which these platinum drugs get into the cancer cells, the research was focused on multiple studies to identify the mechanism for the cellular uptake of these compounds. So as you can see here, human cells, we do have healthy cells. So all our healthy cells, they do exhibit sugar molecules on their cell surface. So what is a sugar molecule? So sugar molecule, as I showed here, this is a polysaccharide sequence. So sugar molecules will be like this. So they are present on all the surfaces of our cells, and they participate in important physiological and pathological processes that are very important for day-to-day functioning of our human body. So we wanted to investigate what is the role of these sugars in the cellular uptake of the platinum drugs, especially into the cancer cells. So as I said, not only healthy human cells, cancer cells also exhibit these sugar molecules on their cell surface, and they play an important role on the cancer cell surface in the cancer cell replication. So these sugar molecules on the cancer surface are very important, and we wanted to see whether they play any role in the cellular uptake of the platinum drugs. So you can see here, this is a microscopic SI. In this SI, in the control experiment, you can see the cell, and in this control experiment, the cells were incubated with a dye that can specifically bind with the sugar molecules on the cell surface. And when the dye binds to the sugar molecules on the cell surface, you get this kind of red coloration on the cell surface. So the cells here are the blue cells, and the red coloration that you see on the surface of the cells is because the dye is interacting with the sugar molecules on the cell surface. Okay, so now it is clear that this dye binds to the sugar molecules on the cell surface. Now the next experiment was focused on seeing how cisplatin interferes in that interaction of dye and cell surface sugar molecules. So initially cells were incubated with cisplatin. This is a clinical drug. So incubated with cisplatin, and then dye was added. So in this experiment, you can still see the red coloration on the blue cell surface. So that means cisplatin is not interfering between the sugar molecules that are present on the cell surface and the dye interaction. So when the similar experiment was performed in presence of triplatin NC, that means when cells are incubated with triplatin NC and then dye was added, you don't see that coloration on the blue cell surface. So that's because platinum drugs have engaged with these cell surface sugar molecules, so that the sugar molecules are not free anymore. So they cannot interact with that dye, and hence you don't see that coloration. So this microscopic assay clearly showed that platinum compounds do bind to the sugar molecules on the cell surface. Okay, so what is now the next question is, okay, they do interact with the molecules on the cell surface, but does that interaction play any role in the cellular uptake of these compounds? So that was the next question. So you can see in this graph here, the black bar in this graph represents a wild type cell containing high level of sugar molecules on the cell surface, and the gray bar shows cells containing low level of sugar molecules on the cell surface, whereas the white bar shows cells that do not contain sugar molecules at all on their cell surface. So now the platinum drugs, the multinuclear platinum drugs, they have been incubated with each of these three cell types, and then their accumulation or their intake of the platinum compounds into each of these cells was determined by mass spectrometry. And then and you can see here the intake of, that is the black bar, the intake of the multinuclear platinum compounds into wild type cells containing high level of sugars on the cell surface is significantly higher compared to the cells that do not have sugars on their cell surface, that is white bar. So there is a significant difference between this white bar and the black bar for triplatinum NC, that is a multinuclear platinum compound. Whereas if you see for the clinical drugs that are cisplatin and oxaliplatin, these three bars are at similar height. So you can see there is no difference between the uptake of these clinical drugs into cells containing high level of sugars on their cell surface, and also into the cells that does not contain sugars at all on their cell surface. That means this experiment clearly showed that GAGs, the sugar molecules on the cell surface, they do play an important role on the cellular uptake of the multinuclear platinum compounds. This is a very important finding. Why? Because this type of preferential accumulation could be highly beneficial for cancer treatment. That is mainly because so many cancer cells, they do exhibit a high level of sugar molecules on their cell surface compared to the healthy cells. So when you have that differentiation between cancer cells and healthy cells, you are getting that selectivity window. So if you can fine tune your compounds that can specifically target the sugar molecules, that means you are improving the intake of platinum drugs specifically into the cancer cells. That gives you selectivity, and hence these compounds can be highly active against cancer cells, and they will be less toxic to the healthy cells. So this is an important finding. So what do they do when they bind to the sugar molecules on the cell surface? So how do they influence the physiological and pathological processes that these sugar molecules involve in? So how do these molecules, platinum molecules, modulate the functions of these sugars? That was the next question. So in the absence of platinum compounds, in general, what happens is that on the cancer cell surface is, as I showed in this diagram here, when you have a sugar molecule on cancer cell surface, what happens is that there will be an enzymatic cleavage of these sugar molecules. So there is an enzyme called a heparinase. This enzyme cleaves the sugar molecules. Cleaving means it breaks the sugar molecule polymers into small sugars. So that cleavage is called angiogenesis. That plays an important role in cancer cell replication. That means these sugar molecules are playing an important role in cancer cell replication. So what if you protect those sugar molecules against this enzymatic cleavage? If you can protect those sugar molecules, then in other words, you're stopping the cancer cell replication. You're stopping the angiogenesis. So as shown in the right hand side of this diagram, the black dots are represented by the platinum compounds, and this branch here in blue color is the sugar molecule, and the big big line here, this is a sugar on the cell surface. So if these platinum compounds are bound to this sugar, then what happens is that enzyme cannot break the sugar on the cell surface, and hence if that can be protected, if that sugar molecule can be protected, we are stopping the cancer cell replication, that is, we are stopping the angiogenesis. So the point here is that these platinum drugs are dual functioning agents. So what is their dual functions is that first, when they bind to the sugar molecules on the cancer cells, they are protected from the enzymatic breakage, and hence the cancer cell replication is stopped at that stage. Okay, so and that is one stage, that is one function of these platinum compounds. But after that, once these platinum compounds gets into the cancer cell, then they interact with the other biological target, that is DNA, and then they kill the cancer cell there. So these are the two mechanisms that these platinum drugs participate in. So these type of mechanisms are very important for developing drugs to treat cancers. So the end result of essentially here, what we are doing here is we are modulating the functions of sugar molecules, the biological and pathological functions of sugar molecules through platinum drug binding on the cell surface to the sugar molecules. So what is the end result of this type of mechanism is that you stop angiogenesis, that is cancer cell replication, and you stop metastasis. Metastasis is when you have tumor growth in one part of the body. It is quite common that that cancer will spread on to the different parts of the body. So through this type of mechanism, what we are doing is we are modulating the functions of sugars, and hence the end result is that the metastasis and angiogenesis can be halted. And once the platinum drug gets into the localized cancer cell, then it will kill the cancer cell by targeting the DNA inside the cancer cell. So these are the mechanisms that these multinuclear platinum compounds follow. So now that was all the introduction for this research. So now it is clear that the sugar molecules on the cancer cells, they play important role for these multinuclear platinum compounds. So it is very important to know how these platinum compounds actually interact with those sugar molecules on the cell surface. Why? Because if you know that the mode of binding and the way they interact with those sugars on the cell surface, then you know the important characteristics of that binding. Once you know those characteristics, then you can fine-tune the platinum drugs and develop platinum drugs that can bind with high affinity to those sugars and perform better activity and show lower toxicities. So that was the idea. That was the reason why we wanted to study the mode of interaction of these platinum drugs with the sugar molecules on the cancer cells. These are my research supervisors, Professor Subanas Fries and Professor Nicholas Farrell. These people have actually proposed this new research field of endeavor, that is metalloglycomics. So I'll take a minute here to explain what is metalloglycomics. So metalloglycomics is coined for this research is because we are dealing with metal-based drugs, and we are dealing with the cancer sugar molecules that are present on the cancer cell surfaces. So sugar molecules are also called as glycans. So we are dealing with the metals and glycans, and hence we named this field of research as metalloglycomics. So now I'll move on to the studies that I performed in the past few years. So here I showed you the differences of the different sugars. when we say sugars are present on the cell surface, all the sugars are not same. There are hundreds of thousands of sugar varieties of sugars that are present on our cell surfaces, and each variety have a significant role, significant biological and pathological role. So I'm here giving you the structures of the prominent sugars that are present in our cell surface. So they are called glycosaminoglycans. So within that glycosaminoglycans, there are like 6 major types of sugar molecules. They are heparin sulfate, dermatin sulfate, hyaluronic acid, chondroitin sulfate, 6-sulfate, and 4-sulfate. So these are different types of sugars that are present on our cell surface. So as I said previously, in my diagram here, so the platinum drugs, they do inhibit the breakage of the sugar molecules on the cell surface by the enzyme. So enzyme, in the absence of platinum compound, breaks the sugar molecules on the cell surface, whereas in the presence of platinum drugs, the breakage of sugar molecules on cell surface is inhibited. Okay, so this is an important finding, but it would be excellent to know what are the important characteristics of the platinum drugs that actually have a role on the inhibition of that breakage, sugar molecule breakage by the enzyme. So to know that, what we have done is that we have used I have used a small library of platinum drugs that have different nuclearity. So this library has mono, di, trinuclear platinum compounds, and they do have positive charge ranging from 2+ to 8+. So the reason using these different types of platinum molecules is that, so when you use different platinum molecules, what are these differences? How are these differences in these platinum molecules are influencing their ability in inhibiting the sugar molecule cleavage or breakage by the enzyme on the cell surface. So if we know the role of this positive charge or the nuclearity on these molecules, then we are getting important pieces of information. So this information will help us in designing better molecules, right? So to know the ability of these platinum compounds in inhibiting the cancer cell surface cleavage of the cancer cell surface sugar, so we have performed this cleavage inhibition studies. For these studies, I have used pentasaccharide as a sugar template. This is a fondopenox, this is a pentasaccharide, and in the absence of platinum compounds, this pentasaccharide can be cleaved into a trisaccharide and a double bond containing disaccharide. For these cleavage studies, we have used this heparinase enzyme. So this enzyme nicely cleaves this pentasaccharide into these shorter fragments within like 24 hours. So we have followed this SI by Proton Nmr. So this is the anomeric region, Proton Nmr of fondopenox. So anomeric region is where you see the H1 protons. I highlighted here H1A, H1B, H1C, H1D, and H1E. So these are the protons you see in this region of the fondopenox. So if the enzyme gets cleaved, then you see changes in the chemical shifts of these protons in this anomeric region. So as you can see here, this is the bottom Proton Nmr is when there is no enzyme added to the fondopenox. So this is nice and clean. This has 5 peaks for 5 protons of the five H1 protons of the fondopenox, and when you add the enzyme, you started getting these minor peaks that are highlighted with this red asterisk. So you see this the one in the far right started decreasing over the time, and the one in the far left started increasing over the time. So this indicates that this fondopenox is completely cleaved are broken by this enzyme within 24 hours time. So this new H4D peak represents the double bond containing proton. So it is because there is a double bond forming here. Because of that, there is a huge shift in the chemical, huge change in the chemical shift of this H1D proton. So what this control experiment confirms is that you have this enzyme completely cleaved the Photonox in the absence of platinum compounds. So next, what we have done is that we added each of our library compounds to the pentasaccharide. This is in the absence of enzyme. So we have just taken the Photonox and added the platinum compound to each of the sample, and then again checked the anomeric region of the Photonox. As you can see here, compared to Photonox, there are changes in the Proton Nmr spectra of these adducts, these mixtures. So what this says is that addition of these platinum compounds changes the chemical shifts of the anomeric protons. That means this is what this is saying is that this platinum compound, they do bind with the negatively charged groups that are sulfate, carboxylate, and sulfamate and acetyl. These are the negatively charged groups. These positively charged platinum compounds, they bind with these negatively charged groups of the Photonox, and as a result, you see this change in the chemical shifts of these anomeric protons. So next, to these samples, what we did is that we added the enzyme to each of those samples and then monitored the reaction for the next 24 hours. So what you see is that only in the sample containing this 2+ charged platinum compound, we saw new peaks. These new peaks represent the cleaved products that the cleaved fragments that I showed in my previous slides. So what this experiment is saying that all the platinum compounds that I used in this study have inhibited the cleavage. So in this control experiment, you see these cleaved products, right? You see these cleaved products. This control experiment doesn't have platinum compounds. Whereas in this experiment, which has platinum compound, you don't see those cleaved products in all the samples, except in the sample containing 2+ charged platinum tetramine. So this experiment is saying that all the platinum compounds have completely inhibited the breakage of the sugar molecule by the enzyme. So that means when they are treated with the cancer cells, what they will do is that they bind to the sugar molecules on the cell surface and they inhibit the cleavage of those sugar molecules by the enzyme. And through that activity, they inhibit the angiogenesis. So that is what this essay is saying. So why this 2+ charged platinum tetramine compound did not inhibit the cleavage? So that is because if you see the charges, if you see the overall positive charges, this is the first molecule here, the mononuclear molecule platinum tetramine. This is the one which did not inhibit the cleavage, whereas all the other molecules inhibited the cleavage. So the conclusions that you can draw here is that the high molecular weight, the high positively charged platinum compounds such as 4+ charged monoplatinum C, 4+ charged diplatinum C, 6+ and 8+ charged AH44 and triplatinum C inhibited the cleavage, whereas 2+ charged platinum tetramine did not inhibit the cleavage. That means the overall positive charge of the platinum compounds is highly important in protecting those sugar molecules on the cell surface against the enzymatic cleavage, and also along with the high positive charge, the dispersion of the positive charge is also highly important. As you can see in mono, di and triplatinum C molecules, each platinum center carries a 2+ charge. That means for example, in the 6+ and 8+ charged molecule, the positive charge is evenly dispersed along the molecule. It's not it's not accumulated at one place, but the positive charge is dispersed along the molecule. That is important. Why? Because as you can see in this pentasaccharide molecule, in this pentasaccharide molecule, the negative charge on the through the sulfate, carboxylate, and sulfamate groups, the negative charge is nicely dispersed. So to protect a nicely dispersed negative charge of the sugar molecules, you need a nicely dispersed positively charged platinum compound. So that is what that experiment is saying us. And the overall positive charge is also important. The platinum tetramine molecule, which does not have high positive charge and which only has positive charge accumulated at only one platinum center, is not effective in protecting the sugar molecule. So that is what this experiment is telling us here. So next, I'll briefly talk about the biological implications of this cleavage inhibition. So you can see here, this is a representation of a cell and cell surface glycans and the enzyme. So in the top reaction here, you have a cell and you have sugar molecules on the surface, and then you have enzyme, which is denoted as HPSE. So this enzyme cleaves the sugar molecule. So in this experiment, we have used an antibody that detects the cleaved sugar molecule on the cell surface. So in this first experiment, this is a control experiment, right? So in this first experiment, you see the antibody on the cell surface. That shows that the enzyme nicely cleaved the sugar molecules, which is important for cancer cell replication. Okay, now we have incubated the cell with the platinum compound triplatin NC and then added the enzyme. Now again, we added the antibody that detects the cleaved sugar molecule. In this experiment, we don't see that cleaved sugar molecule. Again, this is the microscopic assay. In this microscopic assay also, the green coloration around the blue cell represents the sugar molecule cleavage. See, this is a green antibody, right? So represented in green color here. So this green color, whenever you see this green color around the blue cell surface, means that the cancer cell is nicely cleaved. The sugar molecule on the cancer cell surface is nicely cleaved by the enzyme. Okay, so in presence of cisplatin also, you kind of see that green coloration around the blue cell surface. So that means cisplatin also does not inhibit the breakage of sugar molecules by the enzyme. Whereas triplatin NC, in the case of triplatin NC, that is a multinuclear platinum compound that we developed, you don't see that green color around the blue cell surface. So this means that this multinuclear platinum compound inhibited the cleavage of sugar molecule on the cancer cell surface by the enzyme. So what is these are all nice in vitro studies. So what is the implication in vivo? In vivo means in a live animal. So we have done these studies using a mice. So in these mice studies, so what we have done is that, so the control, we have injected the tumor, the breast cancer model of the tumor into this mice, and we have monitored the mice over the period of time. Okay, so now when the mice is injected with the tumor in the control, in panel D here, in control, you can see a big fluorescence here. That means the tumor is like become very big. Growth of the tumor is increased over the time significantly. Whereas with the triplatin NC, you don't see this. You don't see that fluorescence significantly. This suggests that platinum compound actually reduced the tumor growth. So so these are the on right hand side, A shows that this is where this is 0. 0 means this is the starting of the experiment. This is on the first day. So over the time, this is TX1, TX2, TX3 is when platinum compound, multinuclear platinum drug was injected into the mice bloodstream. So first we have injected platinum drug on day 10, and then we injected on day 14, and then we injected on day 18. So gradually, that means the mice is given the drug over the period of 18 to 24 days. So then what we've done is that we have removed. I forgot to say one thing here. So this breast cancer model is known for metastasis. So this tumor type, what it does is that once it is injected into the mice, over the period of time, you see the tumor growth in other parts of the body. So that means this is a very good model for metastasis. So this SI, what will show if platinum drug in fact inhibits that growth, that means this platinum drug is effective against metastasis. That means spreading of tumor into various parts of the body. So here B shows that the green line here is the control, and the red line is the experiment where the mice is given with the platinum drug. So you see, this is the lung removed from the mice. So this experiment B here shows that this is a lung, where lung is not where the tumor was initially implanted. So this is another part. So this B panel B shows efficiency of platinum drug on metastasis. Okay, so this is lung. Okay, in lung, if you see over 18 days, 15, 18 days, and 21 days, the graph, the green line is going higher, whereas the red line is at 0. That means in lung, you don't see the growth when the mice is given with the platinum drug, whereas in control, you see growth in lung where you didn't actually implanted the tumor. That means that's metastasis. You implanted tumor in some other place, and then you saw growth in lung. That means that's metastasis, right? So in presence of platinum drug, you don't see that growth, whereas in the control, you see that growth in lung. So this is a nice demonstration that this platinum drug, which binds to the sugar molecules on the cell surface and protects those sugar molecules against their breakage by the enzyme, actually shows efficacy against the metastasis. This is an important finding and significant finding. And as you can see here, the survival rates. So when the mice is not given with the platinum drug, that means when platinum drug is not injected into the mice, the lifetime of the mice in the control experiment is around 40 days. Whereas when platinum drug is injected into the bloodstream, the lifetime of the mice is around 100 days. That means the survival rate is increased. So and we also saw the growth in lung is decreased. This means this drug is effective for metastasis. So that is the big take-home message here. And so with that, I'll conclude my talk. So what is in my talk, what I have shown you is that previous biological studies showed the platinum drugs can bind to the sugars on the cell surface and protect those sugars against the enzymatic cleavage, which is responsible for metastasis and angiogenesis and cancer cell replication. And for this protection, the positive charge, the protection of sugar molecules, the positive charge on the platinum drugs is very important. And the positive charge dispersion on the platinum drugs also important. That is how it can effectively protect the sugars through those negative charge and positive charge electrostatic interactions with those sugar molecules. And hence, finally, what I showed you is that these non-covalent platinum drugs which can electrostatically interact with the sugar molecules on the cancer cell surface actually inhibit the tumor metastasis in vivo in mice, in healthy, in infected mice. With that, I'd like to thank my research supervisors, Professor Subanas Price and Professor Nicholas Farrell. And I also thank Professor Mark Weinstein, who actually provided us the glycan molecules, carbohydrate sugar molecules. And I also thank Dr. Thomas, and I sincerely thank Australian government for giving us the money, funding to do this research. With that, I'd like to thank you all, and I'm happy to take if you have any questions.
Dr. Anil, that was a very good session actually. I have been following up of what you've been telling about this metastasis and things like that. So from being a pharmaceutical background, I just wanted to know, because platinum falls under ICH2B class, right? So on this, I guess these medicines are all parenteral. They're administered parenterally or orally?
Intraperitoneally?
Intraperitoneally. Yes. So
Yes.
does this have any implications from FDA?
Sorry, FDA?
Yeah.
I mean, what do you mean?
US FDA, because these fall under the class of class 2B.
Exactly, exactly. If you see cisplatin, which is a clinical drug, it is still there in the clinic, and even today people take this cisplatin drug. So cisplatin does have platinum, right?
Okay.
Although it has platinum, it was approved in 1978 by US FDA for cancer treatment. So the thing here is, yes, there are side effects, but those drugs are saving lives. So when you see that balance, so you can increase the lifetime for a certain period of time, and then you can use those drugs along with some other drugs, so that eventually you can reduce the tumor growth. I'm not saying there will not be any side effects. There will be side effects because this is a metal. But if you see the window, the advantages are more compared to the disadvantages. So that was the main criteria which was considered by US FDA when approving that cisplatin. And the other drugs, as I said, there was BBR 3464, which was rejected from phase 2 clinical trials. That was because the disadvantages are more in that case. So what we are trying to do here is that we are trying to establish new mechanisms through which we can develop dual functioning agents that can do two aspects. One, act on the cancer cells and stop the replication, so that you can have a high concentration of drug and at the localized site of the tumor. So when you have when you are stopping the replication, that means you are having a higher so you have more drug influence on that localized site. So yes, there will be some side effects, but we have to see which one will be more beneficial. I mean, if the advantages are more beneficial, then obviously FDA will approve it.
Thank you so much. I have just one question. So suppose there is a diabetic patient and he's on medication. So will that have any impact on the sugar molecules which are sitting on the cancer cells?
That's a very good question. Yes, as I said, we have sugars everywhere in our body. So when we inject a compound that can bind to sugar, you're actually making that you're allowing that compound to interact with all the sugars in your body, right? So that means, in other words, there will be higher toxicity. But the important point here is that we have certain tumors, for example, breast cancers, triple negative breast cancers. They do exhibit high amount of sugars on the cancer. So this is the selectivity that we are looking after. So if you get that selectivity, that means when you give drug, majority of your drug go to the cancer cell, and minority, less amount of the drug may go to the sugar molecules of other cells. So we still have to do extensive clinical biological studies on healthy animals and see what the window is like, and then we'll have more answers.
So one last question. So because you said that this cisplatinum has been in the market since 76, and then you have mentioned that there is a very huge difference in the healing of the cell when the platinum penetrates into it. Okay, so I think that this should really save a lot of patients, but I see that still cancer is prevailing and many patients are at risk.
Sorry, are you talking about cisplatin or the compounds?
I'm talking about the technology. I mean, platinum as such, when you mentioned that it has effective cell penetration and it can kill the cancer cells. So in today's world, metastasis is, I mean, breast cancer is still on rise. So why are these drugs not being able to save many women?
Exactly. I mean, there are drugs that are currently in the market for breast cancer treatment. So these platinum drugs, for example, cisplatin, as I said in my first slides, they are active at the initial stages of chemotherapy, but they are not highly active at the later stages. For example, cancers, if you keep giving the same this platinum drug to cancers are very, very smart. They know how to develop resistance against the drugs. So when you keep giving the same drug to those cancers, they develop resistance over the period of time. So that is the reason why these drugs are heavily given in combination with other chemotherapy drugs. So yes, the research is still in progress. So the research that we are currently doing mainly focuses on inhibiting the metastasis. So the last slide, as I showed, our compounds showed inhibition of metastasis. That is a significant study. So if we in our further studies, further biological studies, if we see that kind of results, that will be a great outcome for us.
I wish you all the best in your research. Thank you.
Thank you. Thank you. If you have any other questions, I'm happy to answer.
Sir, one more question, sir, from Sai Sushma. Apart from cancer treatment, did platinum drugs have any other pharmaceutical uses?
On top of my head, I cannot recollect at the moment. I mean, in ancient times, the platinum, the metal-based drugs, I mean, I'm not talking about platinum, I'm talking about the metal-based drugs. In ancient times, when we don't know a lot about chemistry, for example, silver, iron-based compounds were treated in Chinese culture and in Indian culture. We see these metal-based drugs have been treated for infections, microbial infections. As such, that was the evidence that we know, but there are some other metal-based compounds that are currently in advanced clinical trials for microbial infections. For example, I know ruthenium compound, another compound based on what is that? Gallium, I guess. So that is also in advanced biological studies for treatment against microbial infections. But you're right. Compared to the organic drugs, metal drugs are very, very less that are currently being used for treatments of different diseases. Yeah.
So no more questions, sir. Okay. So thank you very much, Dr. Gorle, for your brilliant lecture on platinum-based drugs for chemotherapy, the advantages, disadvantages of multinuclear platinum complexes, non-covalent polynuclear platinum complexes, mechanisms of this PPC, inhibition of enzymes, and I hope most of the research scholars will get benefited with this lecture for their future research. Thank you, sir. Now I handed over the.
Thank you for the opportunity to present my research.
Thank you, sir. Now I hand over the program to Srimati N. Swati to introduce Dr. Madhu garu. Thank you.
Good morning, everyone. This is N. Swati, lecturer in chemistry from STR College for Women, Rajmahendravaram. Today, I introduce our resource person, Dr. Kiran Sundaraneedi. Dr. Kiran Sundaraneedi obtained his master's degree in organic chemistry from Andhra University in 2007. Thereafter, he started his research career as a PhD student under the supervision of Professor Grant Collins and the University of New South Wales in Australia. During the course of his PhD, Dr. Sundaraneedi thoroughly investigated the ability of iridium and ruthenium based metal complexes as the potential anti-parasitic and anti-cancer drug candidates. After his PhD graduation, he commenced his current professional appointment as Senior Research Scientist at Pharma Research I, Injectable, Lupin Limited, Pune in 2018. In his current role, Dr. Sundaraneedi leads an active research group working on the analytical method development for the complex clinical injectable products. In today's session, he will be talking about his research finding on the new generation of acetylcholinesterase inhibitors as drug candidates against schistosomiasis. Thank you. Now I am inviting Dr. Madhu garu to give a lecture. Welcome, sir.
Okay, thank you. So, can you hear? Hi, good afternoon to all. So, hope all can hear me. Thank you, madam. Thanks for your kind information. Introduction. Sorry. So, hope you all can see my screen. Hello. Hello.
Yes, sir.
Sorry. Can you hear me?
Yes, sir.
Can you see my screen?
Yes, sir. It is clear, sir.
Okay. Okay. Thank you. Thank you very much. Yeah. Sorry. So, thank you all and good afternoon. Thanks for the opportunity. So, today I would like to share some of my PhD work which I did in University of New South Wales, Australia. So, coming to the introduction part of my talk, like as the previous speaker, Dr. Anil, has discussed the role of inorganic complexes, especially the metal-based complexes, metal-based compounds in drug discovery. So, since most of the pharmaceutical molecules or pharmaceutical drugs are small organic molecules, so traditionally pharmaceutical drug development research has been dominated by organic chemistry. However, so in late 60s, 1960s of 19th century, so the discovery of cisplatin, they accelerated the role of inorganic chemistry in the field of drug discovery. You can see the structure of cisplatin, as Anil also mentioned in his talk, the structure of the cisplatin. Over the past few decades, because of the success of cisplatin, modern medicinal inorganic chemistry played a vital role in drug discovery, especially ruthenium complexes has been investigated for several applications. In past few decades, hundreds of ruthenium complexes have been synthesized and investigated as anti-malarial, anti-cancer, and antimicrobial agents. Some drugs are like in clinical trials for the approval of by the agencies. So the major challenges in drug discovery is the first, the identification and appropriate target for the disease. Like what is the key factor for the disease? What is the target? What we can target to find a solution for the in terms of drug to target a disease. And another thing is understanding the mechanism of the mechanism of action, how this target can be like validated or can be chosen. So if you considering the cisplatin mechanism of action of cisplatin, when the cisplatin enters into the body, so it hydrolyzes the platinum, where the chloride groups of the attached to the platinum molecule is replaced by water molecule, and where the water molecule leaves and the platinum molecule bind to form intra and intracellular bind to form intra and intra stand adducts with the cellular DNA and leads to apoptosis, which is called as programmed cell death. So since cellular DNA is the cellular DNA is the becoming a traditional target for metal based on the cisplatin mechanism of action. Even though like several mechanisms are proposed for the cisplatinum action against the cancer cells, but this is the most believed mechanism. So as a consequence, cellular DNA become a traditional target for metal-based drugs. So research was focused on more like designing ruthenium or any other metal-based drugs to design the ruthenium complexes to target the cellular DNA. However, in recent years, so many advanced techniques become available, like genomics, proteomics, tumor imaging, and molecular oncology. These techniques and these advances provide information about more information about the cell biology, and that leads to open these techniques open access to the new targets like proteins, enzymes, receptors, and growth factors, etc. So in present study, we initially our group was also focused in designing molecules, especially ruthenium-based complexes to target a cellular DNA. However, in recent years, our group has shifted interest towards the designing of ruthenium complexes to target enzymes. So targeting enzymes, broadly speaking, like we can target an enzyme in two different ways. One is designing a small molecule which can conventionally target the catalytic site, which is the key site of enzyme activity. So we can target that particular site, and for targeting the catalytic site, we can design a small molecule. And another approach is we can design a big molecule which can target on the surface of the enzyme or protein, because these are the very big molecules and lot of charge distribution happens or lies on overall surface of the protein, like where you can see in the picture the protein and the protein interaction. That is just this second approach, the alternative approach, is to mimic the protein interaction and protein recognition process. That means if you can design a big molecule to target the charge of over the on the surface of the protein, that can be an alternative approach. So we were interested in the second approach, that means to design a larger molecules to target the protein of the surface. In early 60s, like in 1960s, Bayer and co-workers has reported that these ruthenium complexes can inhibit the enzyme. So they reported that these phenanthalin, RU-phenanthalin 3 molecule has an activity against the human acetylcholinesterase enzyme. Based on this molecule, we designed a library library of molecules to target enzymes. So where you can see we designed ruthenium mononuclear and dinuclear and the and the tetranuclear linear and the tetranuclear nonlinear complexes, where we can these two different ruthenium molecules, phenanthrene molecules, are linked through the BBN ligand, so that we can design more nuclear complexes. So this dinuclear means two ruthenium complexes are linked with the BBN ligand, where in trinuclear complexes, these three ruthenium centers are linked through two different BBN ligands. And so on, we designed the tetranuclear and the tetranuclear nonlinear complexes as well. So this CH2 can change, CH2 chain can be manipulated. That means we can use different number of carbons to increase the length of the complex as well. So we designed the 7 REBB 7, 12, and 16 complexes to target any enzymes. So in current study, so give me a second. So we targeted a disease called schistosomiasis, which is very important, and it plays a crucial role after malaria in terms of morbidity and mortality. This particular disease is endemic in more than 78 countries, and almost 700 million people are at risk. And it is especially endemic in South Africa and East Asia as well as South America. So more than 200 million people are infected, and this disease climbs more than 200,000 deaths per year. Apart from the morbidity, mortality, it also affects the lifestyle of the patient very. And there are 2-3 different species in the parasite. So the schistosomiasis is because of these 3 species of parasite. One is Schistosoma mansoni, and Hematobium and Japonicum is the 3 different species responsible for this particular disease. So currently, praziquantel is the only drug effective against the all the species of the parasite. And if you look into the and these days studies are reported that these parasites are acquiring resistance against this praziquantel. So there is a need of inventing a new drug against this particular disease. So if you understand if you see the life cycle of the parasite, it is very complex in nature. This particular when the parasite lies in the blood vessels inside near to the intestine and the liver. So if you can see the picture here, this is how the parasite looks like. The bigger one is the male, and you can see the lean one is lying next to the male. This is the female, and these worms will always lives as a copula and lays hundreds of eggs per day, and these eggs will go into the blood circulation and get trapped by in different parts of the body. So some eggs will release through feces and go into the environment. Once the eggs are in contact with the water, fresh water, so then they form a initial stage called as schistosomula. Then this this Saccharia, it will become Saccharia into the fresh water. So once the eggs are contacted with fresh water, so you can see the structure of different eggs of different species here in the picture, as Mansoni, Japonicum, and Hematobium. These eggs hatches with the freshwater interaction, and then they infected the freshwater snails, and they develop some generation within the snail and releases this stage of the parasite. This will become we can say this is a Saccharia. This stage of parasite is called Saccharia. When the person or when a human get contacted with the water having the Saccharia. So these Saccharia will penetrate through the skin of the person and enters into the body. So then it will loses its tail and this convert into a schistosomia. This schistosomia circulates into the blood in different parts of lungs, heart, and everything. Finally migrated to the livers, like in the blood nails close to the liver and intestine. So this is the overall life cycle, and the life cycle continues. And this is the overall life cycle of this particular parasite. So here in the current study, we decided to target this particular disease, like that means to design some molecules to as a drugs against this schistosomiasis. So as I mentioned earlier, so identification of a target plays a crucial role in drug discovery. So we were in search of identifying a target for to design a drug. So the function acetylcholinesterase enzyme also plays a crucial role in parasite lifestyle as well as the parasite survival. So this particular enzyme present on the surface of the parasite as well as on the nervous system of the parasites. So it also involves in multiple functions like cholinergic signal as well as the glucogen uptake, like nutrition uptake. These enzymes, the enzyme present on the surface of the parasite will help the parasite to get the glucose from the host. So this can be a essential. This is very essential for the parasite survival. So targeting this enzyme leads to parasititis due to paralysis. So this can be an ideal target. We thought that this is an ideal target to design a molecule to get the anti-schistosomal drug. So I will then we decided based on the library of the tablet, like we designed a strategic experimental plan. So where I will display here the technique. First thing is just to identify whether the ruthenium complexes can inhibit the ACH activity from in the extracts made from the parasites. So then the study is to then the plan is to identify the to investigate the ability against anti-schistosomal, the skin stage of the parasite as well as the adult stage of the parasite. Then the next stage is then examine the mechanism of action, that is enzyme inhibition studies using the culture worms. Since we are targeting the acetylcholinesterase, it is always ideal to check whether our hypothesis is working. That means whether the ruthenium complexes are inhibiting ACH activity really to show the activity against the schistosoma. So then the next stage of the investigation is to determine the cytotoxicity against the mammalian cells. Since we are targeting against the parasite, it should only kill the parasite. It should not create any harm or any other reactions towards the healthy cells present in the body. So then for that we investigated the cytotoxicity of these drugs against the mammalian cells. Finally, we determined the dose, maximum tolerated dose for mice to continue the in vivo investigations. So finally, we investigated the in vivo efficacy of these drugs against laboratory mouse model. And this is experimental plan we designed before proceeding the further studies. As mentioned in the strategic experimental plan, initially we examined the series of ruthenium complexes against the different enzymes. Since we are only targeting the acetylcholinesterase enzyme, just we want to make sure that these complexes only targeting the ACHE, that means acetylcholinesterase, not the other enzymes present in the adult parasite extracts. So we just screened at all complexes at 1 micromolar concentration, and we against 3 different enzymes. These molecules inhibited almost particularly these 2 molecules or the 3 molecules inhibited 80 to 90, almost 90% of enzyme activity even at 1 micromolar concentration, whereas they did not inhibit the other 2 enzyme activities even at 10 micromolar concentration. This means ruthenium complexes, particularly RUBB12 tri and RUBB12 tetralinear, are specifically targeting the ACHE enzyme and not any other enzymes. So it's there, that means we can clearly understand this, but molecules showed almost 1,000-fold selectivity towards the schistosoma ACHE. So, and for the continuation of the studies, so we investigated, we determined the IC50 values. IC50 means concentration required to inhibit the 50% of enzyme activity. So we determined IC50 values of different compounds, and we got like some molecules showed sub-micromolar concentration of IC50 values. So, and we also determined the how the enzyme is enzyme activity is inhibited with the molecules, by these molecules. So further, as a next step, we investigated the toxicity of ruthenium complexes against schistosomia, that means the skin stage of the parasite. So we determined the IC50 values for these complexes as well. However, these values looks like higher in numbers, but these are like very huge number of schistosomia, like almost like 200 schistosomias, because this parasite is very big in nature. So we against investigated this molecule site toxicity against schistosomia. So the next step is to identify the effects of ruthenium complexes against adult parasites. So we subculture the parasites in presence of various drugs. For initially, we incubated all the parasites with different types of ruthenium complexes at a single concentration, and we monitored the survival of the parasite over the time. So particularly these two complexes, RUBB12 tetranuclear and the trinuclear complexes, kill the worm within like 2 days. Other molecules could not show any effect on the parasite. So this is the interesting part. And another thing is, it also showed some structure and activity relationship, where you can see here the mononuclear and the dinuclear and the tetranuclear, where the nuclearity of the complex is increasing. The effect of ruthenium complex against the adult parasite is also increased. So this is another interesting finding we observed during the initial experiments. Then we incubated we selected only the tri and the tetranuclear complexes, as these only tri and tetranuclear showed like promising activity in initial screening experiments. So we continued our plans with we incubated parasites with the different of individual complex. Then these are the values where at the 10 micromolars the parasite survived for 6 days. Even at 100 micromolar concentrations, the parasite died within 24 hours. These results clearly showing that the ruthenium, particularly the tri and the tetranuclear complexes, has are effective against both the skin stage of the parasite as well as the adult stage of the parasite, and also they inhibited the enzyme activity in the extracts. So in order to further investigate the mechanism of action, what we did is, I missed this part. So this is how adult parasites looks when we see them under the microscope. Parasite, you can say almost in micron, submicron range. So when we treat the adult parasites in presence of ruthenium complex with ruthenium complexes, you can see these. That means it is also giving one more evidence that because of ACHE inhibition, because ACHE played a critical role in the movement of the parasite, because it also has a critical role in the polygenic signal. So these parasites are coiled together. That means that their polygenic signal is inhibited by ruthenium complex. So, and another thing is, as I mentioned before, the ACHE is also present on the surface of the parasite. So we investigated the surface, how the surface of the parasite was affected after treatment with ruthenium complexes. So what we did is we took some images on scanning electron microscopy of the control parasite. This is how the parasite surface looks like when you see under the scanning electron microscopy. Here you can see the small spike-like structures on the surface of the parasite. These we call as these are the glycogen stores. So that means the parasites store the glucose in the form of glycogen for the survival. So what they do is when they are having a shortage of glucose, they consume this glycogen. They convert this glycogen into glucose and for the survival purpose. So when we investigated the treated worms under the scanning surface of the treated worms under the scanning electron microscopy, so the tubercles, the glycogen stores of this parasite is completely disrupted after treatment with ruthenium complex. So these microscopic studies giving the evidence that ruthenium complex can destroy the glycogen stores of the parasite on the surface and also inhibiting the ACH activity. So these and further investigations on mechanism actions, what we did is like we subculture the worms with different concentration of ruthenium complexes at sublethal concentrations. What I mean sublethal concentration is we treated at very low concentration of ruthenium drugs. So that means the parasite can still be alive, but to investigate whether the first target of ruthenium complex is ACHE or any other component of the parasite. So what we investigated is only at 5 micromole concentration, we culture the worms and to measure the ACHE activity on the surface of the parasite. For that, we designed one interesting assay where we can measure the surface ACHE activity by keeping the intact worm. So that because when we add any substrate to measure the ACHE activity, we no need to destroy the parasite anything. It can stay because the enzyme lies on the surface, so that we can measure the enzyme activity using the intact worm itself. So this assay we designed. So then here we can see in the picture the control worms showed 100% activity, whereas the treated worms show significant decrease in the enzyme activity on the surface. In order to investigate the selectivity, so we choose alkaline phosphatase, any other enzyme which is also present on the surface of the parasite, and we measure that enzyme activity as well. So after treatment with ruthenium complex, only the ACHE activity, acetylcholinesteraseInhibitors enzyme activity is only inhibited, not the other enzyme activity. This experiment clearly giving the evidence that ruthenium complex's primary target is that, and one and only target is only the ACHE. So in further experiment, the interesting part is once the assay is finished, we made extracts from these parasites and control and check the enzyme activity in the extracts. Why we designed this experiment is we got the evidence that ruthenium complexes inhibited the enzyme activity on the surface. So to investigate whether ruthenium complexes enter the parasite nervous system and inhibited the activity in the nervous system as well. So to investigate this the hypothesis, we made extracts from these culture worms and we measured the enzyme activity in the extracts. So in those extracts also ruthenium complexes significantly inhibited the ACHE activity of the parasite. So here we can see the results even at a higher concentration, and there is significantly inhibited the enzyme activities. From these experiments, we can conclude that ruthenium complexes can inhibit the enzyme activity on the surface as well as the nervous system, ACH activity in the surface as well as the nervous system of the parasite. So, and we also investigated investigated for further evidences. So, since I mentioned, as I mentioned previously, this enzyme plays a critical role in glucogen uptake as well as, because this enzyme helps the parasite to get the glucose from the host. So, to investigate that activity, so if you are inhibiting this enzyme, this will affect the glucose uptake very significantly. So what we did is we added the known amount of glucose on the culture media. Then we treated with some parasites with ruthenium drug, sublethal concentration of ruthenium drug, and the control worms we didn't add any other drug. So here we can see that the glucose in the media at 0 hours. This is where we added the known amount of glucose into the media. Here you can see the control worms used almost all glucose within 24 hours from the media, where the sublethal, in the presence of sublethal concentration of ruthenium complexes, these parasites could not utilize the glucose from the media. That means it could not take the glucose inside from the environment. That means this is also providing one more evidence that ruthenium complexes inhibit the ACH activity. As a consequence, it interferes with the glucose uptake of the parasite. So, in further experiment, what we did is we measured the glucose. We made extracts from these parasites. That means the control and the treated parasites, and measure the glycogen from the parasite. As I mentioned before, this parasite stores the glucose in the form of glycogen on the surface of the parasite. Since you can see the control worms, the glycogen on the control worms is very high compared to the treated worms. That means since the control worms can take the glucose from the media, they did not consume their glycogen stores. Here, since the ACH inhibitor, because of ACH inhibitor, these treated parasites could not take the glucose from the media, they consumed their glycogen stores. This is also providing one more evidence that glucose inhibition of interfering with the glucose, the ruthenium complex interference with the glucose uptake. So this is also further evidence of mechanism of actions. These are once we finished all these experiments to investigate the mechanism of action. So we focused on establishing or investigating the toxicity of ruthenium complexes against the healthy human cells. We tested the toxicity of against human collagen site cells because these cells are very close to the where the parasite in the body. This parasite lives in the, where I mentioned before, the parasites lives in the blood vessels close to the intestine and the livers. So we chose these cells which is close to the same environment. So we tested the toxicity of ruthenium complexes against these cells. Here you can see in the picture this dichlorovis. Dichlorovis is a known drug which was used in early days against the schistosomiasis, but they were this drug was discontinued because of its toxicity against humans. So, but previously for some days it was used as a drug. So we use this drug as a control, and the praziquantel is the current drug using for the as an anti-cystodermal drug. So we compared the toxicity of ruthenium complexes against these two drugs. So praziquantel, so what is the outcome of this experiment is ruthenium complexes are less toxic compared to dichlorovirus, and whereas slightly toxic compared to praziquantel. So anyway, these are the only in vitro studies. This gives only some information about the toxicity against the cells. The ultimate experiment to design and to monitor the toxicity of the type is the mice model. So what we did is we chose different groups of mice and to determine how much dose the mice can bear in so that is to determine the maximum tolerated dose study experiments. So this RUBB tetra nonlinear complex did not show any effect even at 10 mg per kg dose, whereas the other trinuclear complex showed was tolerated by mice at only at 4 mg per kg. So even at the higher, at 6 mg per kg and 8 mg per kg, the mice, 1 out of 3 mice was died immediately. So we we consider that only the safest dose is only 4 mg per kg for the RUBB12 trinuclear complex. For 7 tetranonenal complex, we decided to go with the 10 mg per kg dose. So what we did to investigate the further plan, we investigate the in vivo efficacy of the drug. We planned some in vivo experiment. In this experiment, we infected the different 3 groups of mice with parasite. And then we treated one group with RUBB12 trinuclear complex and another group with RUBB12 tetranonenal complex. So in this, the outcome of the study is RUBB12 trinuclear complex significantly reduced the warm burden, that is 42%, and the RUBB, unfortunately, RUBB12 non-linear is very safe, but it did not show any more significant difference in terms of warm burden. It's only reduced only 14% of warm burden after treatment. So for the continuation of mechanism options, what we did is, so we collected, because since the parasite, killing the parasite is not only like purpose of the study. It may also, if you are showing the effect, if the drug is showing effect on the parasite, means because we collected the worms only after 5 days or 6 days of treatment. So that means some parasites are died and some parasites are partially died or partially affected. So they have a compromised life, so that we can reduce the lifespan of this parasite as well. So sorry, I forgot to mention that these parasites can live within the human host for years. So that's why this experiment will become very important. So what we did is, we collected the worms from the in vivo study. We collected the worms from the mice and culture them for 2 to 3 days. Then we collected the eggs and we investigated the hatching capacity of eggs of the parasite. So the treated eggs collected from the treated worms did not show any hatching efficacy, or they did not hatch compared to the controls. So that is also giving evidence that this ruthenium complexes also affected the other parasites, which are that means it showing the effect of ruthenium complexes, the leftover parasites within the mice as partially affected by ruthenium complexes. So we also investigated the morphology of the eggs collected from the treated and the untreated worms. So where you can see in the picture 1 and 2, you see the morphology of the eggs collected from the control worms, where the eggs controlled from the collected from the treated parasites are showing this morphology. That means giving the evidence that it also affecting the life cycle of the parasite, so that we of the parasite also. So the final coming to the final conclusions. So designing the multinuclear complexes could be an alternative approach to target enzymes. So and especially inhibiting schistosoma ACHE, but not any other enzyme. Ruthenium complexes specifically inhibit the ACHE of the parasite, not any other enzymes called alkaline phosphatase and phosphatase diesterase. And it kills the ruthenium complexes are very effective against the juvenile, that means schistosomia, and the adult stage of the parasite. Unlike praziquantel, the current drug used for the treatment is only effective against the adult ones. They could not kill the praziquantel could not kill the juvenile stage of the parasite. And the ruthenium complexes are less toxic to the host compared to the previously anticystomal drug with the same mechanism of action. Dichlorovis is that also means dichlorovis mechanism also same. It targets the catalytic site of the enzyme, whereas the ruthenium complexes target the surface of the enzyme. So in vitro and in vivo studies results were promising. So Further studies will provide additional information on clinical potential of ruthenium complexes as anti-schistosomal drugs. And these are the final conclusions from this particular project. So I would like to acknowledge these people for their support during my PhD work. Here, this is my professor Grant, our professor Grant Collins. He is my supervisor for my PhD, and is Richard for his Professor Richard Keane is also for his support and guidance over the period. And Professor Alex Lucas and Mark Pearson has supported to all these animal studies at AATHM. This is the Australian Institute of Tropical Health Medicine for their support. So when I visited their lab for these animal studies. And also finally, I should also acknowledge our group members at University of New South Wales and all other members from AATHM. And finally, University of New South Wales for the project and the funding. And finally, I would like to acknowledge these guys also who sacrificed their life for the PhD, my work. So almost we sacrificed 250 to 300 mice for these studies. And thank you all, and thank you, especially thanks for the organizers for giving an opportunity to present this interesting work with you all. Thank you very much.
Thank you, sir. Thank you very much to give a great lecture on schistosomiasis, activity of acetylcholinesterase, compare with phosphodiesterase and alkali phosphatase, and how to destroy the parasitic surface by ruthenium complexes, activity of ruthenium drug through SMA-CHE inhibit. Ruthenium complexes inhibits the glucose and reduce glycose storage. Toxicity of ruthenium complexes. Thank you, sir. Sir, here there is a question. Shall I know about the symptoms of these diseases? From Sai Sushma.
Hello, Sudhaker Reddy, sir.
Yes, sir.
Sir, there is a question. Madam, can you repeat that?
Yes, sir. Shall I know about the symptoms of this disease, sir?
Hello.
I think Kiran got disconnected. I do not see him in the participant list.
Okay, sir.
When I have a question for him, but I didn't hear his voice yet.
Okay, sir. Now, vote of thanks by Srimati Tejashwini Madam Garu from SVD Government Degree College.
Thank you, madam. A very good afternoon to all. I am G. Tejaswini, lecturer in chemistry, Government Degree College, SVD Government Degree College, Nadadol. It's a great privilege to me to express my gratitude to everyone who made this international webinar successful. First of all, I would like to thank our esteemed speakers who enlightened us very much. We are very happy to have Dr. Sudhaker Reddy Saripally sir, who explained about OLEDs with industrial applications and giving examples, mobile screens, etc. What we are using now, he explained that thermal properties of different compounds and solar cells. We are very fortunate enough to have Dr. Anil Gorle sir, who explained about the metalloglycomics, anti-cancer platinum drugs very briefly with different process. We are very much glad to have Dr. Madhu Kiran Sundaraneedi.
Tejaswini ma'am, please unmute yourself.
Is it okay, sir?
Okay, ma'am, continue.
We are very much really our sincere thanks to all the resource persons for sparing their valuable time and making this webinar fruitful. Further, I would like to express my sincere thanks to Dr. Padmavati Madam, Principal SKR College for Women, Rajahmundry, for her guidance and support extended to all of us. I would like to thank our beloved Principal, Sir, Dr. T.K. Visweswar Rao, Sir, for his continuous encouragement and support. I would like to convey my gratitude to Sheetal Anand N. Madam for gracing today's international webinar and inaugural address. I also thank Dr. M. Sunita Madam and Dr. CHVV Srinivas Sir, who is backbone of this webinar. I thank the members of organizing committee, Srimati VBT Sundari Madam and Srimati N. Swati Madam, and PL Subramaniam Sir for his technical support. This event is successful because of our wonderful participants. I thank all the faculty members, research scholars, and my beloved students are being with us throughout the webinar and webinar wonderful. Thank you all. Thank you very much. Thank you, sir. Thank you very much. Subramanian sir.
Ma'am.
Madam, am I audible?
Ma'am, shall we proceed for national anthem?
Okay, sir.
Oh.
Sir, gallery view.
Okay, okay. All the participants, please switch on your videos for gallery view. Thank you, one and all. Now it's time for national anthem.
जनगण मन जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे